Welcome. I am Dr. Jason Schmidt from the Vance Thompson Vision location in Sioux Falls, South Dakota, and Alexandria, Minnesota. And welcome to the Dry Eye Dialogue, your one-stop shop for all things dry eye related. I've got two of my esteemed colleagues here, Dr. Nick Risperud out of Fargo and Dr. Lorraine Zimprick out of our Sioux Falls office. So welcome, guys. And hopefully we have a fun hour or so talking about all things dry eye. Nick and Lorraine, anything to add before we get going here?
No, just happy to be here. Happy to talk dry eye with you.
Yep. Dry eye can be tough to treat, so hopefully we'll make it an exciting hour or so today talking about how we attack dry eye in each of our clinics.
Yeah, the goals today is to try to talk about some diagnostic tests that we use, new treatment options. Hopefully we'll get into some good discussion, and then just ways to maybe implement a dry eye treatment practice into your offices there. So before we get started, anything that you want, I usually like to start out with a fun fact that you could tell everybody. Like, Nick, I know you play a lot of golf. Lorraine, you're playing golf, but I've had a hole-in-one before. I don't know if you guys have had a hole-in-one, but that's my interesting fact about me. Nick, how about you?
No hole-in-ones.
No hole-in-ones?
No, interesting fact. I'll say I'll stick with the same I had. I had 23 cavities in my baby teeth growing up.
No hole in one for me. I am not that good at golf. I'll be lucky if it goes in the direction of the hole. But fun fact is that I have shot a coyote with my bow.
That's awesome.
Yeah.
Was it running?
No, it wasn't running.
Was
It was a fairly easy target, but I don't hunt as much anymore, and I'd like to get back to it. So maybe it's somewhere in my future again. I don't think I'll ever have that opportunity again, but who knows?
Yeah. Well, this first section that we want to talk about, we're going to hopefully divide this into 4 groups today, but this first section is to talk about just a little bit of background of dry eye in general. Dry eye is not the most sexy thing in eye care, but it's real. It can be chronic for patients and, somewhat debilitating even, but a little bit of the background. So dry eye is a chronic, progressive, multifactorial disease. I say multifactorial, there's a lot of things that go into why people have dry eyes. Is it medications they're taking? Is it systemic conditions they have? Is it their environment that they're in? Are they contact lens wearers? And screens, we're on digital devices more than ever. You blink an average of 20 times a minute, but when you're on a screen, it goes down to like 2.5 times a minute. And so we're seeing this in a lot of younger kids now too, that they're just on more digital devices than ever before. But it's defined by increased osmolarity. So your tears get more concentrated. There's inflammation and there's neurosensory abnormalities. And I'll get to that a little bit later. 30 million people in the US are diagnosed with dry eye or have dry eye. 30 million have dry eye. Half get diagnosed. So only 15 million get diagnosed. So that's a big difference. And you think about that, 30 million people have dry eye in the US. If there's 300 million people, that's 10%. So if you're seeing 20 patients a day, 2 patients a day you should be diagnosing with dry eye disease. And it increases as we get older, about 2%. So a lot of number 2. So if you're remembering some things in this talk today, think of a lot of 2s. 2% of your patients ages from about 18 to 20 or 18 to 35 have dry eyes, but it increases to over about 20% over the age of 75. And women are 2 times more prevalent to have dry eye than men. And about 28% of patients also have associated symptoms with allergies when they have dry eye disease. So a lot of things going on there. The tests to diagnose dry eyes have advanced a lot over the years. We still do some of these still. There's Schirmer tests that just measure the tear quality, tear volume, but they've advanced a lot to actually measure osmolarity and image glands, meibomian glands in the eye. So Nick, what are your thoughts on these new advancements in diagnostic tests?
Yeah, Jason, I can say I'm really happy we have them because for me, dry eye, I think dry eye is tricky, and maybe I'm the only one, but it seems like my patients with the most clinical signs are not always complaining about their dry eyes. They're wanting LASIK surgery or refractive surgery, and they clinically have dry eye. I can see it, it's obvious, but the symptoms aren't there. Or some of my, patients with the most severe symptoms under the microscope, it's not that obvious. So signs and symptoms don't always correlate very well with dry eye, and that's where I think having these diagnostic tests to help us out really, help us nail the diagnosis. I think dry eye to me is kind of like keratoconus, where keratoconus prevalence now is increasing, and it's not that more people are being born with keratoconus today than they were 20 years ago. It's just that our diagnostics for diagnosing keratoconus have gotten better with corneal topography. I'd say same thing with dry eyes. People are not being born more now with dry eyes than before. It's just our diagnostics are allowing us to treat it, diagnose it, and treat it. And if, with increased, technologies to treat, we're more likely to, find it. It's not, it's not always easy to diagnose something when there's not many treatment options. Well, thankfully now with our diagnostic, with all the different treatment options that we have for dry eyes, we're diagnosing a lot more. So emergence of technologies like ocular surface imaging and tear film interferometry has greatly enhanced our ability to pinpoint the severity and type of dry eye. Utilizing a dry eye questionnaire, using sodium fluorescein to assess corneal staining and measuring homeostasis was found in one study to show 42% positive result in detecting dry eye disease. These tools provide a comprehensive view, aiding in accurate diagnosis and personalized treatment plans. There's two types of dry eye. One, aqueous deficient dry eye, found in about 15% of dry eye patients, and the big one is meibomian gland deficiency, responsible for about 85% of the dry eye out there, with approximately a third of patients having a mixed mechanism of dry eye, having some aqueous deficient dry eye and some meibomian gland deficiency dry eye. A lot of groups and societies created that have been, a lot of groups and societies have been created to target and treat dry eye. Most notorious, the Tear Film Ocular Surface Society, publishing our DEWS reports. They have recently developed a lifestyle report focusing on the U.S. economic impact of almost $4 billion lost due to dry eye, these patients having difficulty driving, reading, loss of work, pain, and irritation. They recommend switching to daily disposable contact lenses as opposed to our 2-week or monthly disposable contact lenses. Avoiding cosmetics with parabens, BAK, formaldehyde. BAK is interesting. I was, I feel like since COVID, we are using like tons of hand sanitizers, or I use hand sanitizer more now than I did in the past. And a lot of the active ingredients on the hand sanitizers that we use, it's benzalkonium chloride or BAK. So the stuff that's killing the bacteria on our hands is often the preservative in some of these eye drops. So be on the lookout for these preservatives. Two more recommendations were keeping screen time to less than 2 hours a day, and then having environmental controls consistent with elevated humidity and stable temperatures in the house.
And I think that's right. I think with the hand sanitizers, people are getting them on their hands, and you don't realize how many times you touch your face or touch your eyes, and that stuff can get on your skin and it can irritate your skin and around your eyes too. But the part about the signs and the symptoms, that's totally right. And part of that is that there are 4 stages to dry eye. Stage 1, patients are asymptomatic. And so that's our job, is to kind of find those patients in stage 1 and to kind of identify that. Because if we don't, then they're going to progress and get worse. They're going to move into stage 2 and stage 3. And stage 4 is very debilitating. And hopefully you never see any of those. But it's the stage 1 patients, and that's the key, is to identify those. Just like when we go, to the dentist or go to get our annual physical, we may not have any symptoms of having 27 cavities in our baby teeth or whatever the case might be. But it's the dentist's job is to identify that you have a cavity and to do something about it, because if you don't, it's going to get worse. And when you go to get your annual physical, you may not have any symptoms of high blood pressure or high cholesterol or whatever it might be. But that's your doctor's job to identify that. And that's kind of what our job is, to identify those patients that are asymptomatic in stage 1, just so that they don't continue to progress and make it more difficult to manage down the road. The neurosensory abnormalities, I guess I wanted to go back to that a second. So it's a cycle. When your eyes are dry, you have inflammation in your tear glands, your lacrimal gland, your meibomian glands, whatever it might be. And then those glands can't produce tears very well. And so then your eye undergoes inflammation. And that inflammation then affects the sensory nerve back to your brain. So you don't get the feedback that your eyes are dry. So then you get less tear production, more inflammation, less feedback. And that's the key of breaking that cycle. And that's the difficult part, is 1, to identify it, but 2, to break that cycle and get the eye back to homeostasis, get the blink rate back to normal, get that lacrimal functional unit back to normal.
Yeah.
Until next time, I guess, stay curious and keep learning. The world of eye care is ever changing, and so are we. I want to thank Lorraine and Nick for engaging with us today. Make sure you visit our website and follow us on social media for additional resources and updates. Tune in next time for an awesome discussion on the Sharp Science Sessions, all things LASIK. Well, I'm your host, Jason. Take care and good night.
Thanks, Jason.